Good afternoon, everyone, and welcome to the California Black Health Network's Health4Life Series on caregiving in the Black community. I'm Rhonda Smith, the Executive Director of the California Black Health Network, and thank you all for attending this important workshop today or webinar today. Our session today is the third in a five-part series on caregiving in the Black community. Today's topic is managing caregiving for loved ones. I'm excited about the topic as well as the speakers that we have for today. Reverend Cynthia Perriott and Valerie Steinmetz will be our key presenters today. And as we think about our lives and healthy aging, I think it's important to recognize that caregiving in the African American community and what that looks like for us and understand the landscape and the current situation for our community and what we can do to be better prepared for and access the support and resources that we need as part of that process and journey of our loved ones. African-American caregivers on average are 47 or 48 years old. They're more often unmarried and more so than all other racial and ethnic groups, and report lower household incomes than non-Hispanic, white, and Asian caregivers. So African-American caregivers typically care for a parent or a spouse or a grandparent who is about 65 years old and may often have multiple health conditions and usually a long-term physical condition. So it becomes quite a challenge for all of us when we're faced with this situation. So most likely at some point in our lives, we may be a caregiver or someone may be a caregiver to us. And so it's critical for all of us to know how to be prepared to plan for caregiving and to be able to advocate effectively for our loved ones, as well as for ourselves in that process. So again, I mentioned we have Reverend Cynthia Carter Perriott with us today and Valerie Steinmetz. I will just go over a few housekeeping things, and then I'll turn it over to them to share their knowledge and wisdom with us today. So if you have any questions throughout the discussion today, please put them in the Q&A box. If you want to say hello to someone you recognize who's present today, you can give them a shout out and say hello in the chat box, but please try to reserve the Q&A box for your questions. Please note that everyone will remain muted throughout the remainder of the session today. And again, think about whatever questions you have as we move throughout the presentation and discussion, and please put them in the Q&A box. And so before we get started, I just wanted to, for those of you who may not be familiar with the California Black Health Network, just wanted to talk a little bit about the organization, who we are, what we do. So our vision is to create a California where every African American and Black immigrant has the opportunity to live a long, healthy life that's free from violence, racism, and health inequities. And we do that every day by ensuring that all Black Californians, really regardless of their education level, their socioeconomic status, their zip code, like their sexual orientation, like who they love or how they identify, or their housing situation, or even where they're from, has the opportunity to access high quality and equitable primary as well as behavioral health care, and definitely avoid unnecessarily succumbing to any type of disease, unnecessarily so. So our first speaker is Dr. Cynthia Perriott, and I'll tell you a little bit about Cynthia in just a second. Reverend Perriott is the Executive Director of the Alameda County Care Alliance. She has over 25 years of experience as a hospice and palliative care educator. Over the last 15 years, she has focused on advanced illness and end-of-life care program development and educational training in the African American community. As part of a national healthcare and hospice organization, Reverend Perriott established a targeted compassionate care approach to communities of color, which has adopted and replicated, or has been replicated across multi-state footprints. She also has served as a faculty member of the Duke University Appeal Program, a palliative care education curriculum for African Americans at the end of life stage. She is a much sought after motivational speaker and advocate for health equity and inclusion for communities of color. She's an ordained minister serving at the historic Ellen Temple Baptist Church in Oakland, which is where she and I met many years ago, as well as a gospel recording artist under her Splendor record label. So very, very busy, as you can tell. Next, I'd like to introduce Valerie Steinmetz. Valerie is a program director at the Public Health Institute in Oakland, California. She manages a portfolio of products or projects and programs focused on the design, development, management, and evaluation of innovative health programs for those with chronic conditions or serious illness. Ms. Steinmetz is the program manager also at the Alameda County Care Alliance Advanced Illness Care Program, assisting with the development of program materials and training and program implementation, strategic planning, continuous quality improvement, and program publications. In 2020, Ms. Steinmetz helped to implement the ACCA's Action App, which is a tool for care navigators to use in the field for case management and data collection. She is also evaluating the CDC My Mobility Plan, a tool for use with rural older adults to help them plan for mobility changes. Ms. Steinmetz received her BA degree from the University of California at Berkeley in public health, psychology, and molecular cell biology. So without further ado, I will turn it over to Reverend Pariat to take us through the presentation today.
Thank you so much, Rhonda. It's a pleasure to be here. Thank you so much, California Black Health Network, for this opportunity. And I'm really excited about this amazing series that you're having that specifically focuses on caregivers, because as we know, many times caregivers are unfortunately left out of the equation when it comes to managing the health and taking care of their loved ones. So I'm really grateful for this opportunity and to share it with my co-collaborator and program manager, Val Steinmetz. And I would be remiss if I didn't thank the wonderful sponsors, both SCAN and AARP, for this great opportunity as well. All right. So our focus today is really all about how do we take a close look at this holistic approach for caregiving for caregivers. And we'll be talking a lot specifically about the ACCA Advanced Illness Care Program. We'll also identify who are the caregivers, and Rhonda shared some of that information in her introduction. We also like to share more data around who caregivers are in our communities. And then what are the resources that are available in both health and mental focused intentionality, if you will, issues around caregiving as it relates to resources. But many times we forget about the spiritual health of individuals that are caring for their loved ones, social supports, and then this important notion about making plans for the future. Many of us know it as focused on advanced directive, advanced care planning. We're going to talk about how important that is for caregivers as well. And certainly, last but not least, training and education. So I'd like to start off by taking a look at really the holistic model that the ACCA Advanced Illness Care Program really targets two specific constituents. One, in hospitals, they may refer to that person as a patient. We call them a person needing care. And then the caregiver, the person that's providing that caring support for that person that's dealing with a chronic, a serious, or advanced illness. In our holistic approach to really this holistic care, we look at 5 cornerstones, and we really are intentional about personalizing the program for the individual participant's needs. In this case, the caregiver or the person that's dealing with a chronic, serious, or advanced illness. So I'll speak very quickly about each of these 5 cornerstones. Spiritual needs. So for someone, the spiritual needs may be issues around their spirituality, their religion, or for others, it may be around what they value most. And so through storytelling and story listening, we really try to get to the heart of what's important for that caregiver in this instance, or a person needing care, and really get to know them and center that around this growing relationship. Our care navigators focus on working with our participants, once again, person needing care or caregivers, for approximately 6-month period of time. And that's through a series of 5 to 12 meetings, both in person, now that COVID is lifting to some degree, as well as in phone visits as well. Health needs, we'll talk more about each of these cornerstones as we really get into the heart of the presentation, but we are a non-medical model. And so we connect people to resources and empower them with tools and trainings. And through this process of 6 months or less or more, given the needs of that caregiver or the person needing care. Advanced care planning, social needs, and caregiving needs are all important cornerstones. And you'll hear more about that as we continue to move forward in our presentation. So let's talk about the care navigators, because these are wonderful individuals that come from our communities. Many of our care navigators come from the faith-based community as well as the broader community, but they're really our trusted, respected individuals. They don't necessarily have to have a medical background, but they are thoroughly trained through our intervention to provide not clinical guidance, but again, this holistic approach to care through the 5 cornerstones that we called out. And so these care navigators are really understanding the needs given these 5 cornerstones. And we'll talk a little bit more about this notion of trusted relationships. As you might imagine, many times in health systems, people may see their physician or their nurse practitioner, if you will, for 15 minutes, maybe 20 if they're fortunate. But our care navigators really draw out the needs of the individuals and spend quality time with them in their home setting or what is ever comfortable for them to really get to know them and have the opportunity to really build this trusted relationship. Goal setting is really an important part of each visit that our care navigators engage in with these participants. And really the idea is to draw out the goal that that participant, in this instance, the caregiver, really wants to have addressed. And it's strictly driven by what that caregiver wants to accomplish, as well as the person needing care. So goal setting is discussed in 100% of our visits, and we're really proud of that. And we find that our health system partners are absolutely excited and really emphasize the fact that we're able to take the time to really get to know what's important to the individual. Our care navigators often say it is a tremendous blessing to serve and really feel that this work that they do as paid care navigators is a calling, that they're responding to their calling. And so therefore we report very low to no burnout. And I think that's really important to call out. You see at the bottom of this slide, there's a quote that comes from one of our care navigators, and I quote, she says, "I am a woman after God's own heart, and this is a faith-based organization." She says, "Spiritually, it's important for me to help families realize there's something more," and the idea being is that there's more that they can tap into to support them through their caregiving process. She says, "I see this program as an opportunity for the community to come together and raise itself up." And so we just really can't say enough about these incredibly valuable, important people that serve as really the folks that have feet on the ground that are serving our caregivers as well as persons needing care. So really quickly, this slide really calls out the 5 cornerstones and simply gives you an idea of the visits that we have and the percentages across each cornerstone that are addressed based on what that participant, caregiver, or person needing care want. And as you see, all of them are over 50%. The spiritual cornerstone we find is really foundational because we get to understand the values of the individual. But in each of these cornerstones, there's a really high percentage based on what people want in their personalized ACCA program. Next slide, please. And I'm going to ask my co-partner in crime with this work, Val Steinmetz, if she would share with us the next several slides.
Yeah, I'd love to. All right, so we want to talk a little bit more about who are the caregivers, and thought this is a great place to start out and share just a little bit from the Home Alone Alliance National Survey in 2021. And then also be able to speak to some of the findings we see in the AC Care Alliance and our work. So in terms of who are the caregivers, if you look at this survey and the number of individuals that completed it that are African American, we see it was over 200, which is fantastic. And most of the individuals, the respondents who completed this that are African American, over 64% of them were female. And I know Rhonda had spoke to some of this earlier as well. We see nearly half of them have high school education or less. 40% are partnered or married. And then just close to 70% are employed. So these are caregivers that are working, many often in full-time jobs. We also know from other research that caregiving can have a really big impact on employment, where a large percentage of caregivers need to make changes, such as reducing their hours or leaving their jobs or retiring early. And we know caregivers can often have competing demands where they're taking care of young children at home and also helping an older parent. In our ACCA churches, we conduct a congregation assessment survey about every 2 years or so, and usually try to do it close to National Healthcare Decisions Day, which is in April. For this last survey that we did in 2019, we had 643 people respond and complete it across 14 churches. So here you can see we had about 67% who were women. Half of the participants were under age 65 and about 8% were under age 35. We found that in this general population of those going to church, we see 15% are caregivers for someone with a serious illness. 43% of them are providing care 7 days a week, and 13% of those are providing care 7 days a week, 24 hours a day, so without a break. We're seeing half of the respondents have completed an advance directive, where they're able to share their wishes with their healthcare providers, family, or friends if they become too ill to speak for themselves. And then we wanted to share some quotations showing our caregiver experiences. And these really emphasize the breadth of our caregiver experiences and their unmet needs. And Cynthia, I can go through these, but please come in and provide some additional commentary. But our first quote at the top, we talk about unmet needs for advanced care planning guidance to really help set up the kind of documentation for our persons needing care and caregivers, which we think are both equally important in the event they're unable to speak for themselves. Our second quote here talks about the need for spiritual support. And then our third one really talks about the need for healthcare support.
And Val, I'll just chime in really quickly and say it's really gratifying to have these caregivers that have received our holistic approach to care through our program, and really call out, in particular, advanced care planning. What we've seen over the years is that because we have this direction that says we're interested in you, Mrs. Smith, as a person, as a whole person, and not just trying to get you to move forward to complete an advanced directive, we find that people embrace more readily the work that we provide. And specifically, we have a much higher rate of advanced care planning completion than the national average. So I wanted to call that out because I think it's really significant that people feel the need and want to be viewed as whole people and not just individuals that a health system would want for them to complete a DNR or advanced directive.
Absolutely. We also had another quotation here, which really underscores the need for resources and support for healthcare decision-making, and really appreciation for getting this support from our care navigators.
And I'll just read it out loud because I think it's nice for us to walk along together with this. This caregiver said, prior to my mother's death, her care navigator provided comfort She gave me phone calls. She followed up. She plugged me in with resources, prepared me emotionally by describing to me the process that my mother may have to go through and the decisions I might have to make. And so it's really important that we hear the voices of the caregivers. And this is one caregiver that really wanted it to be known how much she appreciated as a caregiver, the support of the care navigators, and how it helps her to navigate even the emotional response that you have toward your loved one aging. And in this case, her ultimate passing away.
All right, thinking a little more about caregivers, looking at the caregiver role, this graph shows perceptions and influences on caregivers. And again, this is from the National Home Alone Survey. You can see African Americans are in the orange column. So compared to other groups, you see African American caregivers, they're less likely to say they had no choice in taking on the caregiver role. In the middle area, you see they're less likely to say they feel pressure to take on the role when compared to white, Latinx, and individuals who identify with Asian and Pacific Islander. And we see this really corresponds to a lot of the experiences of our own African-American caregivers in the Advanced Illness Care Program with ACCA. As Cynthia had mentioned about our care navigators reporting it as a blessing to serve, but we hear this from our caregivers as well. And sometimes we hear our caregivers may not consider themselves as caregivers, but more a relative who's doing what they choose to help their family member. And then lastly, in this last area of the slide, the culture religion piece, we see a large percent, pretty close to half of African-American caregivers in this survey report they're influenced by their culture or religion in their decision to become a caregiver and be in that caregiving role. Wanted to show a few more slides with data from the Home Alone survey too. And for this one, again, we can see African-American Black caregivers in the orange column on the left. And you can see some positive effects of caregiving reported by caregivers. In this first area, we can see more than 70%, actually across all of them, more than 70% said that being a caregiver eased the worries they had about their person they were caring for. It made their relationship with the person closer. They learned new skills. And they felt that this was an important contribution to the person needing care's well-being. Here you can see some of the outcomes reported by family caregivers. Again, look at this orange column, and this is from the Home Alone survey. You can see just over a third of African-American caregivers reported that their health is fair or poor when you compare it to excellent, very good, or good. In this section right here, we can see 15% reported they're depressed. And this next area is around strain. You can see African-American caregivers are less likely than other groups to report they feel strained due to this role. And we really see this in the ACCA work as well. We see caregivers report they appreciate this role and the opportunity to support their family, but they really don't think of this as a strain on themselves. And then finally, in this last area, social isolation, we see about 40% of African-American caregivers report that they feel isolated socially from their family and friends as a result of this role. So now we're going to think about resources that can be helpful for African-American caregivers. And just wanted to point out that more and more we're seeing national organizations are really recognizing that role of caregiving and the impact it can have on the health of a caregiver. In our ACCA program, we actually focus on caregivers' health as well as being able to have the caregiver help their person needing care. And within our program, we see that caregivers are reporting they have about 1.5 medical conditions themselves, which is really close to the average among the persons they're taking care of. We've had caregivers themselves become persons needing care while they're in our program, where they actually do need care for themselves as they now have a chronic or serious illness. And so just wanted to show some of these resources here. And then specifically with these two on the right, we'll talk about those in a little more detail. They come from the ACCA Advanced Illness Care Program. So one of these tools we call our 8 Ways to Feel Better tool. And this is one our care navigators use and work with participants. It's really a great way to form that trusting relationship with participants, but can be very helpful for individuals that say they have fair or poor emotional health. Here you can see there's 8 different ways that are listed, and we actually, over the years with our navigators, have found 8 additional ways. Use this as a way to help identify goals for participants and can help follow up with them. And thinking about these 8 ways to feel better can really empower individuals and can often promote self-care with our care navigators themselves. Another resource to consider is our workbook for caregivers. And this is, again, this is a larger workbook. I'll show you on the next slide 4 main areas, but it really focuses on helping the caregiver taking care of themselves and identifying ways that they can find support and assistance they may need in caring for their loved one. So the workbook itself, it's made up of 4 different parts. We have an area on what is needed, where the caregiver can work with the care navigator and start to develop a list of caregiving activities and needs that the caregiver has, as well as their person they're caring for. There's another area where you can think of who can help. And we consider this being able to develop a fellowship of other people, different agencies, different organizations that can help the caregiver in meeting some of the needs they have and in caring for their loved one. We have a section focused on advocating for support and help. So our navigators can work with caregivers, help prepare them for conversations when they need to make requests to different organizations or ask for support in order to help their loved one. And then finally, we have our caregiver well-being tool. And this can help the caregiver identify activities or situations that can really increase their sense of well-being. So really making sure that the caregiver is being cared for and caring for themselves. So with that, I'll turn it back over to Cynthia to speak to some of the spiritual health resources that we have.
Thank you, Val. So I think what you've heard so far from both Val and myself is really an important point I want to reiterate, and that is the fact that caregiver health to the ACCA and the work that we do is an important priority. It is absolutely an important priority. And so again, when we talk about this holistic approach to health, that's mind, body, and spirit, our resources for spiritual health include our intentional focus, once again, on developing a personal ACCA program for caregivers and persons needing care. And so under the spiritual cornerstone, again, we really draw out through storytelling and story listening, what are those stories, and tell those stories, encourage that participant, that caregiver, to tell their personal stories and how their growing up and their life and their present experiences impacts and speaks to who they are as an individual. And even additionally important to that is, what are their values? We also have an important tool that we call the 5-finger exercise tool. And it really is a tool that focuses on visualization, helps an individual to lower their level of stress. And we find that our caregivers absolutely love this tool. And so our care navigators are trained to walk with the caregivers as well as persons needing care to lower their stress level, visualize really positive experiences in their life experiences, and help them to know how important and valuable they are as individuals. And then for those folks that are religious or spiritual, we have select Bible readings that we also provide to our caregivers as well as persons needing care. But we also connect with several churches and faith institutions. And of course, many of us are aware that there are just incredibly valuable resources that can help and support caregivers within church ministries, various events. I'm thinking one event in particular that the ACCA has sponsored, frankly, for several years, and we call it the Caregiver Recognition Celebration, where we lift up caregivers, we provide them a beautifully white tablecloth catered meal, and we serve them to let them know just how valuable and important they are. Resources for social support. So there are several resources that are out there that can assist individuals with either meals, meal preparation, and of course, many times people think of Meals on Wheels, but there are also other organizations as well. Mom's Meals being one of them, Project Open Hand. These are organizations that are in the California area, and we have vetted all of our social support referral sources, if you will, and we find these are very strong social support in the area of meal and meal preparation. Next slide. Many of you may be familiar with California's IHSS, or in-home support services. And again, this is an opportunity to have a caregiver, could be a family member or otherwise, help walk with that person that's dealing with a health challenge. And so this is an important resource as well. And again, in the state of California, many of you may be familiar with this important supportive service program. So Val spoke a bit earlier about advanced care planning, and I did as well, as we talked about that 5 cornerstone approach. This actual workbook that you see in front of you was developed as a result of hearing from our care navigators, our pastors, some of our participants, to really zero in on how they wanted to think about care planning now and in the future. And so I'm super proud to say that we developed a care planning workbook specifically out of the faith-based African-American community. And you're looking at it here, and we have access, direct access to it. You can have direct access to it through our website, and we'll be providing that for you before we close out today's presentation. So the actual workbook focuses on 3 key areas: think, plan, and do. When we think about what it is that we want, think about our life as a whole and our wishes, that's an important first step when it comes to care planning. Secondly, once we've given thought and attention to what we want, then of course, the actual planning. What choices are best for you? And again, tremendously important that it's about you as an individual and no one else. What are your wishes? And we really believe in empowering people to have their voices heard. And then, of course, in the last section of the care planning workbook, that's the doing, literally recording those choices. The care planning workbook provides that opportunity to literally have that information documented. And if you have 2 witnesses, there's no need for a notary, of course, in the state of California. So we really try to meet the participant, that's the caregiver and the person needing care, right where they are. And this slide very quickly just speaks to the number of community events and videos that we're able to provide. I spoke about the Caregiver Recognition Celebration. You see on the far left there, one of our brochures and programs for that actual day. Below that, one of our care navigators, Alexis Owens. We have stories that are featured where our navigators speak about the decisions that they made or the struggles and challenges that they had making advanced care planning decisions and how they overcame some of those challenges. And then I choose to prepare. This is an event that we many times have provided in the past, where we have spoken word artists, dance, really expressive ways to get to the heart of making decisions and empowering yourself to make those decisions as caregivers. And then last but not least, We have pastor physician dinners. We have these informal opportunities so that pastors and physicians can both share the similarities that they have and the challenges, and how important it is that both of those stakeholders really understand how the community, particularly the African American community, needs them to be more respectful and understanding of one another and the important roles that they play. Next slide. And Val, I'm going to shift back to you for the resources for caregiving and the medical and nursing task.
Perfect. Yeah, so did want to touch a little bit on resources for caregiving for medical and nursing tasks. We see 60% of caregivers nationwide perform complex care in the home. Often today, patients, they get just discharged from the hospital, they're sicker, they leave kind of quicker, and there's just a lot more tasks you see here that family members often have to help with and in the home setting. Caregivers, they can provide an array of supports you can see here, from the personal care and household tasks to these medical nursing tasks, financial decision-making, care coordination, and really, again, providing this increasingly complex care in the home. We see there's many family caregivers that feel ill-prepared for these tasks, especially these nursing and medical tasks. And with ACCA, you heard from Cynthia discuss the in-home support services that can often provide some assistance here. We see that when our caregiving visits, when we have visits that address caregiving, over 60% of them discuss in-home support services, as well as discussion around respite care in 35% of our caregiving visits. When you take a look at this, the medical nursing tasks, the difficulty and support, you can see a large proportion of caregivers across all race and ethnicity groups report that they found tasks difficult and that nobody helped prepare them. You can see over 2/3 of the family caregivers here reported they had to learn at least one task on their own, and between about 1/3 and 1/2 of family caregivers reported that at least one task was difficult to perform. You can see while Asian Americans were most likely to report that the tasks were difficult or that they learned it on their own, the differences between groups were not significant overall. And just wanted to mention how AARP has prepared a series of videos that can help caregivers perform these complex tasks in the home. They can include things like wound care, giving injections, and other important care tasks. They're short, helpful, and easy to follow, and you can see the link here. Also wanted to mention caregiver resource centers. And you may remember the presentation with Donna Benton on this in this series a few weeks back in June. And there are 11 different centers that cover the whole map of California. And you can find one in your area by going to this CRC website. This is free, and they offer many services for free to caregivers in California, which are funded by the state and other donations. So they can include family consultation with an expert, access to funds to support hospice care, legal consultation, and counseling services. There's also caregiver support groups and classes to support family caregivers. The CRCs, they have an app portal called Carenav, where individuals can go to. There's a uniform assessment tool here, and you have the ability to track and report services and supports. And again, you can access this through CRC's website. There's also another initiative here, CalGrows, that offers trainings for caregivers. There's caregiver coaching, you can get free support to help you with courses, career planning, goal setting, and then there's also free training that can enhance kind of career growth opportunities for individuals. So with that, Cynthia, I'll turn it back to you to talk about one of our upcoming workshops.
Thank you, Val. So the ACCA has an upcoming workshop that focuses on the workbook for caregivers that we've developed in this great work we've been doing now for about 10 years. And so the training session for caregivers on ACCA's workbook, we have not secured the date as yet, but you can certainly reach out to us on our website, which is care-alliance.org. We're really excited about the continued development. And of course, with the usage and the actual execution of the workbook for caregivers, this will absolutely be a wonderful training session for caregivers. So we hope that you will go to our website and make that request. Next slide, please. So we are at the conclusion of our presentation, and we would love to once again thank the California Black Health Network for the opportunity today. And we'd also like to thank our wonderful ACCA partners, the Public Health Institute, of course, UC Davis School of Nursing, and we have so many other wonderful partners, both national, regional, and local, that we'd also like to acknowledge. So thank you all so very much for this opportunity. And we'll open up the floor for Q&A.
Well, thank you, Cynthia and Valerie, for your time today and for sharing, I think, what are amazing resources that I think at least for me, I was not aware of. I'm familiar with the ACCA, but some of the resources that you shared today, I was not familiar with. So thank you for bringing those to our attention. And I don't see any questions in the chat, but I do have a few questions of my own. And so Cynthia, you and I met several years ago, and I remember when you were first getting the ACCA off the ground. I think at the time there were 4 churches that were part of the Alliance, and now there's 40 churches across the state. So first of all, kudos to you for growing the resources that are so much needed in our community. But I wanted to know if people who are in Southern California and other parts of the state outside of the East Bay want to know what churches in their community are providing this resource and service. Is that information on your website?
Yes, it absolutely is. And thank you for that question, Rhonda. We're excited about some new regions that we've recently started doing this work in. Los Angeles, we have some great work, a regional director and team, Trevino Cochran and team there in LA. So you can go on our website and learn more about how to connect with Trevino and team. Santa Clara County and San Mateo County, also in Northern California, are new regions for us. As well as, I know I'm skipping some new regions, San Francisco. How could I forget San Francisco? So we started expansion work in San Francisco, as well as Alameda and Contra Costa counties. So we're excited about the continued expansion of the work. We continually hear that there's a need for this model in including and engaging lay people that have the ability to really get excited about what we often hear as a calling to be a care navigator. And we have the curriculum to provide the training for folks. And it's really exciting. So I appreciate that question, Rhonda.
Oh, sure. No problem. And, when we think about palliative care and end-of-life issues and advanced directives, it's something that I think it's hard for many of us to think about, and a tough conversation to have. And I think we are faced with that decision kind of when the time is here or right in front of us. But you can also execute or determine your advanced directive like well in advance. So can you talk about that as part of maybe our own individual care planning and how that might work, or what suggestions you have for how that could work or should work?
Yeah, and that's a really important question. I have to share with you that one of the things that we've seen, particularly in the last 3 years with COVID being a pandemic across not only this country, but around the world, some individuals, younger individuals, frankly, that weren't thinking about decisions around what they want or don't want in the event that they can't speak for themselves. But COVID kind of pulled the wool off many folks' eyes and said, you know what? this could happen to me. I don't know what the future holds, but it's important for me to really think about who would speak for me if I can't speak for myself, and what kinds of things do I want or don't want in the event that I can't speak for myself. And so we try to help the community and the Black community really, and communities of color, really become more empowered with the fact that their voice matters. And it's important to make sure that their voice is heard. And we have the ability, once again, through the work of our care navigators and the work of the ACCA, to walk with any person 18 years or older to complete an advanced directive. And so I think there's so much to learn. I think that we don't typically have the opportunity and the time when we are seeing our physician or primary care physician or nurse practitioner or the healthcare system as a whole. We don't have the time and opportunity to really have our questions answered. And we can help walk through that process with individuals free of charge. So really important that we all empower ourselves, whether we have a health challenge or not. It's really important to think about making those decisions in advance.
I totally agree. And I know that often, conversations don't happen very often for people of color when we look at the data, right? When we talk about end of life issues and palliative care and making serious decisions. And some of the research that we've done over the past few years revealed that providers don't necessarily engage in those conversations with their Black and brown patients like they do with their white patients. So when you talk about empowerment, it's important for us to be empowered about our health from the prevention aspect all the way to end of life and everything else in between. So this is a conversation that we as individuals can bring to our providers as part of our care planning overall for our health and well-being.
Yes.
Rarely wait. So that's an important thing. And I think,
Absolutely.
is there a question in the chat, Amber? I saw somebody just posted something.
Yeah, we do have one quick question. Antoine is chiming in here. Great point about decisions and advanced directives. Do you get involved in trusts and wills, or do you make referrals to those types of decisions?
Appreciate that question, Antoine. So we do get involved from the perspective of making referrals. And so we seek out trusted resources that are directly connected and involved in that process of trust and wills. And then we provide those resources to our participants. And so we don't get involved directly other than vetting the resources, making sure they're legitimate and good resources. And then we provide those referrals to caregivers and persons needing care.
Great, thank you, Antoine. And I also have a question. I want to provide the opportunity for anyone who has a question to also ask and not monopolize all of that. But I'm really curious about, what type of support you provide for when the time comes for someone to be in hospice care, and how do you support caregivers in that process?
That's a really, really good question, Rhonda. So many of our team members have been involved in hospice care, either through our personal experiences with parents or grandparents. Some of us have worked with and for hospice organizations and palliative care organizations. And so we're really equipped to not only provide really answers to deep questions that our constituents, caregivers and persons needing care, family members have around these important topics. And so what we do is we have videos, we have presentations, and then personal and direct experience that we share with our audiences, as well as our caregivers and persons needing care, about what are the myths and misconceptions that we're hearing about hospice care. And there are many. There are a lot of stories that are both positive and negative, and we keep the floor open for all of them, and really give people the opportunity then to hear some of those myths and misconceptions and ways that they can manage those relationships. Hospice is an amazing benefit that is paid for 100% by Medicare and Medi-Cal, and pretty much 80% by most insurers. However, a lot of people don't know that. And then they don't know how to manage that relationship. For example, if the primary nurse that is involved in a hospice case, if there is a personality conflict or there's a sense that there's just not the kind of respect that happens in that relationship, we train our caregivers as well as our persons needing care and family members that you can politely ask for a different practitioner involved in your case. And you have that right because you paid for that benefit. It's completely paid for as a result of your being employed in this country. And so that's just one example. So we really get involved with helping to provide information, answer some misconceptions, but also help people to see how there's amazing benefits to both palliative care and hospice care, help them to understand the differences, but also help them to make decisions about when they may want to raise the issue with their primary care physician. So there's a lot of learning there that we get deeply involved in to assist our participants.
Good to know. And one last question before we wrap up. I'm curious to learn more about the Action app and how that works. So that's, I guess, a question for Valerie. If you want to talk a little bit more about the Action app.
Absolutely. Yeah. So Action app, that's the name we've given to the app. It is from Demagi and their ComCare app. And we had done an extensive search to try to find a solution for case management, as well for our navigators, as well as our leadership and evaluation team. So we ultimately found this organization and their ComCare app product, which really fit our needs. Some of the most important pieces being a sustainable solution that we could, use and have some lower support service costs over time. We really needed to be able to track, our navigators needed to be able to track their work with participants over time. We saw many solutions where you do one assessment and then you're kind of done, where we have those 5 to 12 visits. It could be more, it could be less, but being able to pull that pertinent information that our navigators have gathered after building this trusting relationship with the participant and be able to see that information and have it presented in a meaningful way. So the ComCare app, now our Action app, does that in a very helpful way. And then also being able to use it offline. So our care navigators use this Action app as they're meeting with and working with participants. It rolled out to our navigators right when COVID started. So it was a way for them to use it while working with participants virtually and on the phone. And now that we are going back and having in-person visits again with participants that are interested, they are able to use and bring their Action app and their tablet with them during the visit to record information and see and access important resources that way as well.
Great. And before I wrap up, I'd like to give both of you an opportunity to, share some parting words, key things to think about or takeaways for everyone from your discussion today. So Cynthia, we'll start with you.
Thank you once again, Rhonda and the California Black Health Network for this just amazing opportunity. And we salute you all for really being intentional about how do we walk with our caregivers, how do we elevate them and give them the sense of the vital and important role that they play. Just really thrilled to have this opportunity to share the work of the ACCA and the resources that we can bring to the table, as well as other organizations as well. I can't overemphasize just the importance of caregiver health, caregiver holistic health, and honoring them as individuals and helping them to honor themselves. And we're hopeful that as a result of this workshop and the series of workshops, that caregivers get the sense that they are important to their loved ones, they're important to their community, they're important to the health system, because they're able to impact in ways that the health system has not been able to make impacts because they are in the home setting and very important and essential for that person dealing with health challenges. And so we see them, frankly, as indispensable. They're just tremendously important. We want them to know how important they are, and we are here for them, and really grateful that they are those humble servants, frankly, that they are, and how they continue to do so. So thank you again for this opportunity to share, and hopefully we've touched someone's mind, heart, and spirit to recognize how valuable and important they are as caregivers.
Thank you, Cynthia. And Valerie, what about you?
Yeah, I absolutely echo everything Cynthia has said. Caregiving health and caregiver health is so important. I think there's just so many more things caregivers are being asked to do from the healthcare setting, more and more complex tasks, and just being able to understand what's available to them, how they can help the person they're caring for, at the same time making sure that they are caring for themselves, I think are two huge areas that they focus on and need help with. And we know ACCA can absolutely help with that, as a caregiver themselves can be a participant in a program. It's not just for those that have a serious illness. So being able to recognize the importance of caregivers, that they have their own needs around their health, as well as providing care for persons that need care.
Well, thank you. And thank both of you so much for your time today and for your willingness to be part of this program and share some valuable information for all of us that I think at some point in our life we will definitely need to take advantage of. And so I just have a couple of things to share before we say goodbye today. Want to remind everyone about some upcoming sessions that we have as part of the Health4Life series. On September 7th, we have another session 5 in the Control the Controllable, which is our diabetes education series focused more on prevention and pre-diabetes. And that topic is sleep, your body, and diabetes at 5 p.m. We will have another session 4, as part of the Caregiving in the Black Community series, and something that Cynthia and Valerie touched upon at the end of their talk today is about making sure we take care of the caregiver. So the session on September 7th is about caring for the caregiver. I'm sure there will be another great session of valuable information for us to learn how we can make sure that we take care of ourselves as we're caring for others and our loved ones. On September 21st, another session in the Control the Controllable series focused on managing stress and balancing diabetes prevention. October 5th, session 7 is smoking cessation. And then October 19th, in recognition for Breast Cancer Awareness Month, we will have a session that's part of the work that we're doing around the Non-Toxic Black Beauty Project. And that session will be focused on brands, beauty, and breast cancer at 12 p.m. Pacific time. And then November 9th, we have the 5th and final session in the Caregiving in the Black Community series, focused more heavily on resources and how to navigate those resources as we go through our caregiving journey. You can keep up with all that we're doing and register for those sessions via our website. You can join us as part of the Campaign for Black Health Equity. Also follow us on social, which is really easy to remember. It's Your CBHN on Facebook, YouTube, and Instagram. On LinkedIn, it's California Black Health Network. Thank you all for joining us today. We hope that you were able to take away some key learnings and valuable information, should you be faced with a caregiving situation for a family member or loved one. So thank you all. Have a great afternoon and a great weekend. Take care.